The RDA for iodine is 150 micrograms. The RDA was set probably close to 100 years ago, give or take a little bit. Goiter is a swollen thyroid. The thyroid sits in the lower part of the neck. It weighs about 1.5 ounces and produces about a teaspoon of thyroid hormone for a whole year. And, if a goiter is big enough, you'll see it sticking out of the neck like a softball. Big worry at the highest levels of the US government that farmers weren't going to be able to manufacture enough food to feed the growing population. About 150 micrograms, per day took care of the problem. And the animals were now procreating correctly, able to have offspring and growing to the right size. And he reported his findings, and the government, went into action. It was one of the really first public health things that we've done in our country. And they mandated that iodine be put into salt because it's an easy thing to do. And they put in enough iodine and salt to hopefully get Americans about 150 micrograms per day of iodine or close to it. Iodine's main job in the glandular tissue is to maintain the normal architecture of the glands. So if we call this the normal architecture of the glands, it's normal. The glands include the thyroid, ovaries, uterus, breast, prostate, and pancreas. And the first thing that happens in iodine deficiency in these glands is you get cysts in these glands. And if it goes on longer, the cysts become hard and nodular. If it goes on longer, they become hyperplastic if you take a biopsy of them. And if the end of that pathway, the end of that continuum is cancer of the glandular tissue. And animal, test tube, and human studies have shown iodine is able to halt this progression wherever it catches it and sometimes be able to reverse it. If you think about the problems we're having today in our country, the fastest growing cancer in the United States, thyroid cancer. We're seeing 1 in 7 women in the US, adult women in the US diagnosed with breast cancer. 1 in 3 men in the United States are estimated to have prostate cancer. We have pancreatic cancer growing at epidemic rates. When I was young and in my training, you saw pancreatic cancer in people. It was in the hospital, you'd see them in alcoholics, drug abusers, and older people. You never saw it in young people. Now we got pancreatic cancer and people in their 40s and 50s. And, prostate cancer, I saw it in my training days. It was all older guys. Now you got prostate cancer of men in their 40s. Breast cancer, it was older women. Now I've been to funerals of some of my patients in their 20s dying of breast cancer, diagnosed at 18, 19 years old. The iodine deficiency is the big problem with it. I didn't start off with this. I mean, I didn't know about iodine the first 10 years of my holistic practice, and learned about it after that. And I can give you that story if you want to hear it. But if I've always said that if the government comes to my practice and says they don't like it, which they have done, but if they tell me further, you can only do one thing, and then you go back to doing straight conventional medicine. You get one, what do you want to do? I would say just give me iodine. And I think it's the biggest bang for the buck. It's a cheap nutrient. The whole country's not getting enough iodine in. Our iodine levels have fallen 50% over the last 50 years across the United States. And we are more iodine deficient now in our population than our predecessors were, than our parents' generation, our grandparents' generation, our great-grandparents' generation. And we're suffering from it with this epidemic of glandular problems.
So, although we don't see the goiter as being as much of an issue, doesn't mean that we're not iodine deficient. Yes.
That's a great observation. And
Okay.
I was going to touch on that when I was into that. And so there's enough iodine in salt and enough salt out there that it really has taken care of the goiter problem. And you don't see, I have some patients where it's, sticking out of their neck here, but they're in the minority. So that was really public health miracle, but it's not, the highest concentration of iodine's in the thyroid, but you need iodine in the breasts, the ovaries, the uterus, pancreas, the prostate, the skin, the muscles, the fat. Thyroid has, what is the number? Like 1 or 2%. I might be off on this. It's in my book, but a small percentage of the body's total iodine load. The highest iodine loads in the muscles and the fat tissue. And but the thyroid has the highest concentration of iodine because it's so important. You can't make thyroid hormone without it.
Right.
But all the glandular tissue, you can't make hormones without iodine, any of them. Ovarian hormones, testicular hormones, adrenal hormones, none of them can be made without adequate amounts of iodine. The answer to your question is, yeah, there's enough iodine in salt to prevent goiter, but it's not enough iodine to give optimal or minimum, even minimal, but not enough to give optimal levels for the rest of the body's needs.
So people will say, okay, fine, I'll hear this, I'll take iodine. Some people will react with even one drop of the Lugol's 2% or 5% iodine. And then they're saying, oh, and so then their thyroid doctor says, yeah, you're not supposed to take a lot of iodine.
I call this medical, well, I didn't call it. My mentor in iodine, Guy Abraham, coined it, so I'm just using it. But there's a disease that's taken part in, most doctors, holistic and conventional doctors, it's medical iodophobia. And you know, they don't know the research, they don't know the science, they don't know the physiology and biochemistry behind it. And one of the complaints with iodine is, well, it causes autoimmune thyroid disease and Hashimoto's and Graves' disease. When iodized salt was brought in, the research and the interest in iodine kind of just evaporated. Now, it was in the late 1920s, and shortly after that time is when pharma started to make its push for drug therapies. Penicillin was brought out, and the march of pharma control things, and iodine being a natural substance couldn't be patented.
Of
So
course.
the interest in it just kind of faded and it was just gone. So part of the demonization of iodine is people don't know about it. In med school, I don't know if I was taught about iodine, or if I was taught about it, it was probably a one or two sentence thing that iodized salt was a great public health miracle and iodine deficiency was a thing of the past. Well, it's a thing of the past if you don't check for it. But look at the National Health and Nutrition Examination Survey. Iodine levels have fallen 50% over the last 50 years or so. And most of Americans are deficient in iodine, according to the NHANES study. So, you know, if iodine was responsible for causing this autoimmune thyroid epidemic, which is occurring, we have Hashimoto's and Graves' disease occurring at epidemic rates right now.
Right.
Now, this is occurring at epidemic rates at the same time iodine levels have fallen 50%. That's a negative correlation. Now, that just proves iodine is the cause of that. Now, might be something else, but it's not iodine. And in my practice, we treat Hashimoto's and Graves' disease with iodine. Hashimoto's usually goes away, Graves' disease gets under control. Iodine was the treatment of choice by my predecessors a couple generations ago for Graves' disease and Hashimoto's. It's all over the literature from the old early 1900s to maybe the mid 1900s literature. And I found it very successful. I have two girls, two young daughters. Well, they're now physicians working in my office, which makes me very happy. And when they were, I remember the exact age, maybe 10 and 11 or 11 and 12 years old, we're having dinner one night. And my wife just says to me, "Hey, do you think they got a thyroid problem?" And I remember I had a fork full of food or something ready to go in. And I'm like, hold the fork. And I'm like, I just like hit my head like, like, whoa, how does she pick it up? And I do this for a living and I don't see it.
Right.
So the kids were complaining of being tired. And I mean, they were doing soccer and, things, but they always had headaches. They're always tired. And, I just kind of chalked it up to growing young kids and stuff. So I drew their blood work. They both got Hashimoto's disease, and which is an autoimmune condition of the thyroid gland where you're producing antibodies against the thyroid gland. Now, if you talk to the medical iodophobics, it's rampant in conventional medicine. It's a bunch of holistic doctors feel the same way. And for whatever reason, a bunch of naturopathic doctors have this altered wrong view. They'll say iodine causes autoimmune thyroid disease or worsens it. Well, my kids weren't taking iodine at the time, yet they have raging autoimmune thyroid disease with antibodies in the hundreds, and their thyroid levels were all screwy. So when I lecture, I've got lab slips showing the results of my daughters over the years as I put them on iodine and as I up the dose of iodine. Now, it wasn't just iodine. Iodine should be used as part of a holistic treatment regimen where you clean up the diet, drink water, exercise, eat good, get the junky food out of your diet and correct other nutrient imbalances. But it was iodine with them. That was really the only thing that I changed. And you saw these antibody levels just go down in a linear correlation with both of them. Now
Right.
my girls are 29 and 28 years old. Haley, I don't think she has signs of Hashimoto's. I think it's, zero. And Jesse's just got very, very low levels of titers. I mean, theoretically, really, she could be classified as Hashimoto's because she's got low levels of titers, but they were no, they were, I don't remember, 500 to 900 range. She's like
Wow.
25 now or something like that, you know. So they verge. they really don't have Hashimoto's or symptoms of Hashimoto's anymore. And to disprove a theory, you know, you only need an N of one. You know, a hypothesis has to hold true for everything.
Right.
So if iodine caused Hashimoto's disease and I put these two girls on iodine and their Hashimoto's goes away, well, iodine doesn't cause Hashimoto's disease. It's something else. Now, will iodine flare Hashimoto's and or Graves' disease? Once in a blue moon, I see it with my patients. And it's not very often. And I think it's because, you know, if iodine's deficient in the body needs these iodine receptors, which are in all the glandular tissue. You know, you need iodine to make thyroid hormone. T4 and T3 have 4 atoms and 3 atoms of iodine attached to thyroglobulin to circulate through our bloodstream and stimulate our thyroid receptors. Well, if iodine's not there, something's going to bind to those receptors. And what happens to bind to them is bromine. So in the halides in the periodic table, and I hope I'm not getting into too much of the weeds here.
That's fine.
The halides are group 17, and these are chemicals arranged on sort of similar properties and similar size and shape and things. So the halides include iodine, fluoride, bromide, and fluoride. So there's 4 halides, there's a fifth, but there's 4 major halides, and 2 of them are essential and 2 of them are non-essential and toxic items. The essential ones are iodine and chloride. We can't live without either of them. We have tons of chloride in the form of salt in our body, sodium chloride. We should have, 2 grams of iodine in our body, which nobody does, unless they're taking it now. And so what's happened is bromide has taken over that. Bromide is very close size and shape to iodine, and we're inundated with bromide. Bromide's in food sources and in sodas. It's in vegetable oils. It's in consumer goods. It's a fire retardant in the computer I'm talking to you on, and it's in our iPhones. It's in carpet, curtains, and mattresses. And, when I was doing original work with Dr. Abraham and we were checking people's halide levels, we found huge amounts of bromide. The sicker they were, the more bromide they had. The more bromide they had, the less iodine they had. I wrote about a study in my book where I checked breast cancer patients versus non-breast cancer patients. It was 2-fold higher bromide and 2-fold lower iodine in the breast cancer patients compared to women without breast cancer. So this bromide has taken the place of iodine, and it's been shown in animal studies that you can brominate thyroid hormone. So T4 would mean 4 atoms of bromide. T3 could mean 3 atoms of bromide instead of iodine. Now, we don't really know, because they haven't done the studies, what's the effect of brominated thyroid hormone instead of iodinated thyroid hormone. I would guess, since whoever designed us didn't design us to have brominated thyroid hormone, that's probably not a good thing. And we know bromide's a toxic substance for the body. So when you give someone iodine, it's going to displace, or it's called competitive inhibition of bromide and fluoride. I'm not talking much about fluoride because fluoride's hard to measure, and it's a smaller, much more electronegative substance than bromide, and it's more toxic to the body. So the body, when you take in fluoride shouldn't be in our water supply. It shouldn't, we should be avoiding fluoride. Very toxic substance.
Or in our toothpaste.
Look, what they should have done, the damn studies with fluoride, was just put it in toothpaste and nothing else, and see, does it really, whatever.
Cavities, yeah.
But anyways, and it doesn't help with cavities because countries that have pulled fluoride out have the same cavity rate as countries that still have fluoride in. Anyways, another story, another podcast for you. So when you give someone iodine that's full of bromide, they have to go through competitive inhibition where bromide will be released at huge amounts, and they can get sick from that.
Right.
And that's the problem. So what I see with patients who don't tolerate iodine, as you described it, they start taking it and they don't feel good, is I have them stop. I have them up their salt intake and take an extra teaspoon or 2 of unrefined salt a day for about 2 weeks, and then try the iodine again. And I can tell you over 95% of them can now take iodine. And there's still a patient here or there who can't take iodine. And for whatever reason, and I have a couple of them, but I'm 30 years of doing this. I don't have many of them. And it's way less than 1%. It's, way less than 0.1%. I've been with my 2 partners for 25 of the 30 years, something like that. And if iodine was causing all these problems, either we'd be out of business or we'd be in jail, because we got we have a huge practice of people on iodine. Can everybody take iodine? No. Can everyone take vitamin C? No. Can everyone take magnesium? No. It's done the right way, and with the idea that, you can get competitive inhibition, you can get bromide toxicity, and bromide, a Herxheimer or a detox reaction from bromide if you understand that and if you do it right, you don't have to suffer from medical iodophobia, and you can get the benefits of iodine.
Okay, so let me piggyback to what you said. So ever since having you on 2 years ago in our supplement protocols, we always recommend iodine because I'd say we don't focus on thyroid, but we get so many people that have either hypothyroid or Hashimoto's, and once in a while we get tricklings of Graves. But every single person we recommend iodine. We have an iodine protocol. We had one specific person. The father was working with us, then had the daughter come in because she got diagnosed with Hashimoto's at the age of 16. We tried to clean her diet, but she didn't want to get rid of all of that. But the only thing she changed then consistently was adding iodoral. She didn't want to do the drops, so she took like the 50 milligrams, and her antibodies dropped tremendously. Her fatigue dropped. So I can, a testament
Similar
to you.
story. Yeah.
And
Similar.
we have people in our practice that their antibodies go down with just taking iodine.
You can get too much water. You can get too much anything. Yes, you can get too much anything. And look, some people are more sensitive than others. What would I just do with that lady? Oh, I was telling her, my usual. It's a lady I went to elementary, middle, and high school with who sees me as a patient,
Okay.
and I don't really consider her a lady. I consider her a girl because I just think we were still kids. But so she's super sensitive to everything, and I just saw her, and I said, "Hey, my usual dose of this is two twice a day. You start with one a day, just see how it goes, and." Keep in mind, my usual dose is two twice a day, and you adjust this at your dosing schedule. So there's no way on God's earth she's going to be able to take two twice a day when I gave her, because she's just super sensitive to things,
Okay.
and so I recognize that. And so when we're talking about 25 milligrams, like most of my patients are on 25 milligrams per
Okay.
day. I don't I don't have a practice where I'm just doing iodine, where I don't see patients, I don't talk to them, I don't do a physical exam, I don't do lab work. I'm like, hey, nice to meet you. Go take 25 milligrams of iodine, see you in 6 months. And that's not how I do things. And so everyone's individualized. Although I can tell you the vast majority are on 25 milligrams. If they have glandular disease, thyroid, ovaries, uterus, breast, prostate, pancreas, I'm missing one of those glands. But if they have glandular disease, I'll use more. And if they have cancer, sometimes more. And not everyone can tolerate that, and you just individualize it. So, so selenium. So I do, when we see patients, we all have our own. There's 6.5 practitioners. My younger daughter's finishing her residency and will be there full time soon. But when we see our patients, we do a full hormonal and nutritional workup. So we're looking at
Okay.
selenium levels and magnesium levels and B6, B1, B2, B3, all the levels. And we're trying to optimize the deficiencies sort of together. So
Okay.
iodine's rarely used as a single nutrient. That's all we're going to do. I don't know if I've ever done it that way. I finished residency. I'm a conventional doctor. I tell people I never prescribe vitamin. I never took vitamins growing up. I grew up in a conventional household. We got sick. We went to the doctor. We took what they took, what they gave us. We never questioned anything medically. I would love eating McDonald's back in the day. I eat fast food, and I never really paid attention to my diet. And I had bad asthma. I was on puffers and going to the ER every few months for steroid shots, and I was sure asthma was going to kill me at a young age. I had really severe asthma, and so I finished my residency, and my turning point came about 6 months into practicing, when I'm in a busy family practice office, and we, in this area. And it was strict conventional medicine, just like we were taught. And we were seeing, I don't know, a lot of people a day, just like we were taught. So I was spending 5 minutes with them, not asking about their diet, not concerned with what they're eating, just trying to prescribe the drug to treat the diagnosis that I made at that time, since that's how I was taught. But I was doing this for about 6 months, and I just realized it was 3 nights in a row I didn't sleep well. And first time, and I didn't sleep much at all. And I wake up to go to work, and I got this anxiety that's sort of taken hold of me. And Allison and I are getting dressed together, and she's getting ready to go to work. And I said to her, I don't want to be a doctor anymore. So here I am, the end of my residency. I'm 29, and we had $100,000 in student loans. And she looks at me and she goes, "What's wrong?" And I'm like, "This sucks. All I'm doing is prescribing drugs, spending 5 minutes with people. I mean, I'm not help. I said I'm not helping them unless they have an infection. I'm not helping them."
Right.
And I'm having to use more drugs to treat the side effects from the first drugs. And I said, "I can't do this for 30 years. And she said, "What are you going to do?" And I said, "I don't know." And she goes, "Why don't you do another residency?" And I'm like, no, one of those was enough. And so I was floundering. And that day at the office, I'm tired, I'm anxious. I see this patient, and his wife worked with Allison. They drove downtown Detroit together for their job, and we were friendly with him. And he kept bugging me to meet this chiropractor. And I didn't want to meet a chiropractor. I never referred to chiropractors. I said they were dangerous. I never met a chiropractor in my life. I never went to one. I didn't know what the philosophy was.
Sure.
We were taught they were dangerous, and no one should see them. So I had shoved him off over this, but in this anxiety, and he wanted to meet the chiropractor not because he was adjusting him, because he was doing nutrition on him, and he said that really helped him for his problems. So I took his name, and I remember at lunchtime that day, I left him a message. Hey, let's get together for dinner. And he calls me up that night. We schedule a dinner for the following Tuesday. Tuesday rolls around. I get home from work. I said to Allison, I'm going to cancel dinner. I really don't want to meet this guy. And she said, that's rude. You need to go. You already scheduled this. It's too late. And as I'm walking out the door, she said, be nice. So I went. His name was Dr. Robert Radke. He starts talking about functional biochemistry and nutrients and how they're required for all these biochemical pathways to work right. Now, I had 2 courses of biochemistry. I had one at the University of Michigan, defending national champions, and I had one in med school. And I got A's in both. I was good at biochemistry. I was good at chemistry. I got A's because I could memorize things and spit it back out, but I didn't really understand it. I didn't understand functional biochemistry and how it impacted somebody like you as a patient of mine. I was just like astounded. First off, he's smart. He's a nice guy. He knows more functional biochemistry than I did. And I thought that's really interesting. I wasn't taught this in med school. And he brought me a book at that meeting, Healing with Nutrition by Jonathan Wright, who was an allopathic physician. So I took the book home. I read the book till late at night, and I went to bed after 2 a.m. Now, remember, I hadn't slept well during that time period. Now I'm kind of jacked up and excited. Before I go to work, I called my dad that morning, and I said, hey, it was before cell phones, so I couldn't call him from the car. But I said, hey, can you come in the office this morning? I want to draw some blood tests on you. So based on what I talked about with Dr. Radke, based on what I read in that book, I drew 2 things on him. I drew a full thyroid panel instead of just a TSH level like I was taught in med school. And I drew his testosterone levels. And my dad's testosterone levels below detectable limits when it came back. And his thyroid levels were in the reference range, but in the lower part of the reference range. So I put him on natural thyroid hormone, natural testosterone. And within 7 days, his 20 plus year history of angina, continual chest pain. Anytime he did anything, he'd get chest pain, pop a nitro pill. It went away. Calls me up after a week and he says, hey, I didn't have angina today. 30 days later, I recheck blood work on him, and his cholesterol, which was stuck in the 300s for 2 decades or 3 decades or something, on medication, falls below 200 without changing any of his bad habits. And his numbers all looked better. His whole chemistry improved. And more importantly, he looked better and acted better. People were asking, what are you doing? He started to be able to lose weight for the first time. And, once I saw the changes in my dad, I knew that's what I wanted to do in medicine. So from that moment on, I started checking people's hormone levels. Really, everyone gets a full hormonal and nutritional evaluation when it comes to see our practice. And hormonal evaluation is it's what's done. That's what I did with my dad. That's what everybody gets.
Was there ever an issue with excess? I'm assuming no, because we use Hakala labs now, and their testing is 50 milligrams, and we have not had a single client that had issues taking that much. And just
if you have normal kidney function, there should be no issues.
Yeah. Okay.
So if you don't have normal kidney function, we don't really know because the studies haven't been done. But with mild to moderate renal failure, I've not had a problem using these same doses of iodine. If it's severe kidney failure, I dose the iodine lower, just as I would anything that's cleared through the kidneys. But about 98% of orally taking iodine is cleared through the kidneys. And therefore, these doses that we're talking about, 50 milligrams, 100 milligrams, 200 milligrams, should not really cause toxicity problems. Now, you can have bromide problems, you can have Herxheimer reaction problems from it, or maybe allergic reactions to it if you're allergic to something in it. But as far as toxicity problems go, that shouldn't really be the case for the vast majority of people.
Yeah, and we've seen the same thing. So I don't know if it was through your interview, but I ended up starting to work with Hakala Labs to do testing. And so everyone obviously doing that test has taken some level of iodine because they're wanting to see if they're sufficient. And we have maybe one test of like the many that we've done that was sufficient in iodine. Everyone else has been deficient. And then when they choose to do the bromide test and the fluoride or chloride, the bromide is often, fluoride is also a little elevated, but bromide is almost always elevated. So then they even need to take more iodine even from that. But it's just interesting that these people are like, oh, I'm probably sufficient, I'm just going to test. And then almost everyone is deficient, even though they're testing.
So I would say to your listeners, if a woman has fibrocystic breast disease, which there was an autopsy study which showed 88% of US women have fibrocystic breast disease, whether they know it or not. But
Okay.
if a woman has fibrocystic breast disease, she's iodine deficient, period. And that's
Oh,
the cause of it, and that's the treatment for it. If she has ovarian cyst disease, she's got iodine deficiency. If a person, male or female, has autoimmune thyroid disease, they're iodine deficient. If they're pancreatic cysts, ovarian, uterine, breast, prostate cysts, or prostate growth, they're generally iodine deficient. So it's the glandular tissue. Remember, it's maintaining the normal architecture, and then cysts, nodules, hyperplasia, cancers, that continuum that iodine deficiency will cause.
does the iodine deficiency affect a certain glandular gland first? Like, would it be that, or does it vary per individual?
Well, I think that there's got to be competition in the glands for iodine, especially when things are
Right.
scarce. And the same mechanism, the sodium iodine symporter, which is a little taxi cab that moves iodine from the bloodstream into the gland, which has been shown in the thyroid and the breast tissue and the ovarian tissue. It's probably in the rest of the tissues, although I don't think there are studies saying that, but I'm sure it's the same mechanism. And
Per
I think the glands will compete for iodine, especially when resources are scarce. And I can't tell you why this woman's going to have cystic breast disease and not cystic ovary disease, and
okay.
maybe she'll have a goiter. Maybe the goiter will be the problem, and maybe the breast won't be the problem. I don't know. I don't have enough wisdom for that one. But I think it's the same mechanism that's causing, these problems. But what's really common is they'll have fibrocystic breast disease, they'll have thyroid disease, and they'll have ovarian disease all together. And if it goes on longer, they'll start to get pancreatic disease, and men will get prostate disease. So, having multiple glandular diseases is unfortunately the common thing right now in our toxic world we live in, depleted toxic world we live in.